How post-traumatic stress disorder, PTSD, affects relationships and how to heal together. Post-traumatic stress disorder, PTSD, is a mental health condition that often arises after an individual experiences or witnesses a traumatic event. PTSD affects not only the individual who suffers from it but also those around them, especially in relationships. The emotional and psychological challenges of PTSD, such as intrusive memories, heightened anxiety, and emotional numbness, can create significant strain in romantic, familial, and social relationships. However, with the right understanding, communication, and strategies, it is possible to heal together and rebuild trust, intimacy, and connection. In this article, we will explore how PTSD affects relationships and discuss strategies for healing and maintaining healthy connections, both for the individual experiencing PTSD and their loved ones. 1. How PTSD affects relationships. PTSD can have a profound impact on relationships, creating emotional distance, miscommunication, and strained bonds. The symptoms of PTSD, such as flashbacks, nightmares, hyperarousal, and avoidance, can interfere with how someone interacts with their partner, family, or friends. Common relationship challenges. Emotional withdrawal. One of the most significant impacts of PTSD is emotional numbness or detachment. Individuals with PTSD may withdraw emotionally, making it difficult for their partners or loved ones to connect with them. This withdrawal can lead to feelings of rejection, isolation, and frustration. Increased irritability and anger. Individuals with PTSD often experience heightened irritability or anger, which can lead to frequent arguments or emotional outbursts. The individual may struggle to control their emotions, leading to tension in relationships. Trust issues. PTSD often stems from experiences where the individual felt betrayed, violated, or helpless. As a result, people with PTSD may find it difficult to trust others, even those closest to them. This lack of trust can create barriers in romantic relationships and friendships. Avoidance of intimacy. PTSD can make it difficult for individuals to be intimate, whether physically or emotionally. Trauma survivors may struggle with feelings of guilt, shame, or fear that prevent them from feeling comfortable in intimate situations, potentially leading to a decline in sexual intimacy or emotional closeness in a relationship. Hypervigilance. PTSD can cause an individual to be overly alert to potential dangers, leading them to become hypervigilant. This constant state of alertness can make it difficult for them to relax or feel secure, which can be taxing for both the individual and their loved ones. Key insight: PTSD can cause emotional distance, irritability, trust issues, and avoidance of intimacy, creating significant challenges for individuals and their relationships. How to heal together, strategies for couples and families. While PTSD can strain relationships, it is important to recognize that healing is possible with the right support, communication, and commitment from both the individual with PTSD and their loved ones. Here are some strategies for healing together. Open and honest communication. One of the most important tools in healing a relationship affected by PTSD is open communication. It's essential for both partners to express their needs, concerns, and feelings in a way that fosters understanding and empathy. The partner with PTSD may need to explain their experiences and emotions, while the other partner should listen without judgment. Set aside time for regular conversations. Designating time to talk about how the individual with PTSD is feeling can create an opportunity for expression and mutual support. Acknowledge emotions without dismissing them. When discussing difficult emotions, avoid invalidating each other's feelings. Avoid phrases like "just get over it" or "it's not that bad." Instead, listen with empathy and offer reassurance. Seek professional help together. Couples and families affected by PTSD can benefit from family therapy or couples counseling. A trained therapist can help both parties understand how PTSD is affecting the relationship, as well as guide them through practical steps to improve communication and manage emotions. Couples therapy. Therapy focused on couples can help both partners understand the impact of PTSD on their relationship and develop coping strategies for managing it together. Family therapy. For families, Therapy can help each member understand the dynamics of PTSD and how to offer appropriate support to the person experiencing the symptoms. It can also address any family conflicts or misunderstandings that have arisen due to the disorder. Learn healthy coping mechanisms. Both the person with PTSD and their partner or family members need to develop healthy coping mechanisms for managing the stress, anxiety, and frustration that can arise in relationships. This may include mindfulness and relaxation exercises. Practicing mindfulness or relaxation techniques, such as deep breathing or meditation, can help reduce stress and improve emotional regulation. Physical activity. Engaging in regular physical exercise can help reduce tension and improve overall well-being for both partners. Emotional support. Both partners should work on providing each other with emotional support, particularly during difficult moments when PTSD symptoms are triggered. Set boundaries and manage expectations. It's important to set realistic boundaries and manage expectations in relationships affected by PTSD. The person with PTSD may not always be able to engage fully or emotionally, and it's important for both partners to acknowledge these limitations and work together to create a safe space where both individuals feel heard and understood. Set clear and respectful boundaries. It's important for both parties to establish healthy boundaries, especially if there are moments when the person with PTSD needs space to recover or process emotions. Be patient. Healing from PTSD takes time. Partners need to be patient with each other and with themselves, recognizing that progress may be slow and that setbacks are a natural part of recovery. Key insight: open communication, therapy, healthy coping mechanisms, and boundary setting are essential strategies for healing relationships affected by PTSD. When to seek help: recognizing signs of relationship strain. While healing together is possible, there are times when the strain on a relationship may become overwhelming. If relationship difficulties persist despite efforts to communicate and improve, it may be necessary to seek professional help. If one or both individuals are experiencing continued emotional withdrawal, frequent conflict or arguments, feelings of hopelessness or frustration, physical or emotional abuse, or severe breakdown in trust or intimacy, it's important to reach out to a therapist or counselor who specializes in PTSD and relationship dynamics. Sometimes, couples or family members may also benefit from individual therapy to address personal struggles or unresolved trauma. Key insight: if relationship strain continues despite efforts to heal, seeking professional help is crucial to restore balance and improve emotional well-being for both parties. Conclusion: PTSD can significantly affect relationships, leading to emotional withdrawal, irritability, and difficulties with intimacy. However, through open communication, therapy, healthy coping mechanisms, and patience, both individuals and their loved ones can heal together. It's important to recognize when professional help is needed and to be kind and patient with each other during the recovery process. With the right support, it is possible to rebuild trust, intimacy, and connection, creating a strong foundation for a healthier and more fulfilling relationship.